So again, a neutropenic diet would be a type of diet prescribed for someone who is at risk for contracting some sort of foodborne illness. And certainly we all are at risk, but someone with a compromised immune system with cancer treatment or organ transplant or HIV/AIDS, they would want to be served, or we would want to serve them a diet that is neutropenic. So no fresh fruits or vegetables, no undercooked eggs, no undercooked meats, and we would just use the utmost care to be safe when providing nutrition to them. If we have a cancer patient or HIV patient that is having difficulty with meeting their nutrition needs, there is a medication that we can recommend the provider prescribe, and that medication is called Megace, Megace. It's a derivative of marijuana, and as many of you know, marijuana can give people the munchies, so it's sort of the same pathophysiology as marijuana, so Megace can be prescribed to help improve intake. And our last slide for Chapter 6 is HIV/AIDS. AIDS is an acronym for Acquired Immunodeficiency Syndrome. This syndrome is also commonly seen with wasting, cachexia. Individuals with AIDS may lose up to 34% of their body weight in the months prior to their death. So we really need to address malnutrition here, provide high protein, high calorie foods. Definitely look at supplementation like using Ensure or Boost or Carnation Instant Breakfast or high protein puddings, high protein oatmeals, things like that. One of the side effects of treatment of HIV/AIDS is oral thrush and mouth sores. So if they're very sensitive to hot temperatures or cold temperatures, we'll want to make sure that we serve them food that is at room temperature. We'll want to make sure that we're serving them foods that aren't acidic and eating away at the mucosal lining of the GI tract. And recall, this could be the same recommendations for our patients that have cancer, that are undergoing treatments. For example, chemo and radiation therapy can really mess with that mucosal lining throughout the GI tract. Some of the reasons for weight loss that we'll see with HIV/AIDS, altered taste perception, and that can be caused by this polypharmacy, which is 5 medications or more prescribed, and you'll see these folks on just a cocktail of medications. Dry mouth, decreased energy to eat, excuse me, anorexia, oral thrush like we talked about, depression, nausea, vomiting, diarrhea, and some kind of infection in the GI tract, malabsorption in the GI tract, inadequate diet, and then decreased gastric acid secretion. So again, look at Chapter 6 for some methods that will help us work better with HIV/AIDS patients and getting them the nutritional care that they need. So that's going to end our discussion on Chapter 6. Wild ride, definitely a lot of information here, but you have these videos that you can go back and review over and over again. Make sure that you go to the discussion board this week and look at the video on diabetes and carbohydrate counting. There's a short quiz that you take. It's not graded, but it'll just help you get more familiar with the carbohydrate counting, which foods have carbohydrates, and what a normal portion looks like. And then head to the diabetes folder under this week's material, and there you'll see some education resources, some listings of carb counts of food, and then more information on carbohydrate counting. I included on there one of the handouts that I utilized when I worked in diabetes care, one of the patient handouts, so you can sort of see what patients would have access to. All right, we will see you in Chapter 7, which is when the rubber meets the road. So we're putting down all of this information that we've learned on diagnoses and MNT, and then we are coming full circle into the assessment. So I look forward to our discussions with that. Give me a call, email me with whatever questions you have.